Jeremy, a 28-year-old husband and son, goes to the doctor because he has been feeling strange recently. The doctor tells him that he has terminal brain cancer for which there is no cure. After spending weeks discussing with the doctors on way to slow his disease, Jeremy makes the decision to move to Washington, where death with dignity is legal. He traveled all the places he ever wanted to go with his wife, spent time with his family and friends, and even went skydiving before feeling the effects of his disease. Jeremy did not want to suffer, become a burden on his family, or even have to spend the last weeks of his life in a hospital bed, racking up medical bills that his wife would eventually have to pay. Therefore, Jeremy, along with the assistance from Compassion and Choices, made the decision to wait until he felt the time was right, plan how he wanted to die, and eventually end his life on his own terms, free of pain and surrounded by his family and friends. Euthanasia, or physician-assisted suicide, is the practice of intentionally ending a life in order to relieve pain and suffering. When mentally competent, terminally ill patients experience the side effects of treatment and pain and suffering associated with their disease. Some may believe that since there is no cure, death on their own terms is better than suffering, becoming a burden, or slowly dying in a hospital. This practice is surrounded by numerous moral, legal, and ethical controversies that have ignited heated conversations as well as court battles across the United States. Human rights as well as physicians' obligations have been discussed, examined, and surveyed to determine if physician-assisted suicide is tolerable and which forms are more accepted than others. Dying with dignity allows a patient to choose where, how, and when they want to end their life with the assistance of medical professionals to ensure that there is no unnecessary pain or suffering. There are a variety of types of euthanasia that a patient may choose to end their own life because an illness is affecting the ability to be independent, their quality of life, causing extreme pain and suffering, or because they want to die on their own terms. The first being physician-assisted suicide, in which a doctor prescribes equipment or medication with which a patient understands that they will use these to end their life. According to the study in the reporting rate of euthanasia and physician-assisted suicide, physicians may discuss this option at the patient's request and then consider assisting the patient in ending their life, and all of the following criteria are met. The patient's request for euthanasia is voluntary and well considered. The patient's suffering is unbearable and hopeless. The physicians inform the patient of his or her disease and the treatment options. The physician and the patient are both convinced that there is no other reasonable solution, and the physician consulted at least one other independent physician who saw the patient and agreed with the diagnosis and treatment options. Another option is euthanasia, which includes both passive and active forms. Active euthanasia is similar to a physician-assisted suicide, in which the patient makes the request to end their own life and the doctor obliges. According to euthanasiaprocon.org, passive euthanasia is where a physician lets the patient die, either by withholding a life-sustaining treatment. This may occur if a physician chooses to end life or withholds life-extending medications or operations with or without the patient's consent. Finally, the patient has the right to refuse medical treatment either in the form of a living will, advance directive, or a do not resuscitate order. This gives the patient the power to choose which kind of procedures or treatments they would not like to receive in the event that they are not competent to make the decisions at that moment. This includes the right to refuse life support, CPR, and other life-sustaining treatments. Death with dignity suggests that a person with an illness should have the right to refuse medical treatment and make the decision to end their life when they choose, leading to concerns regarding law, ethics, and moral issues of both the patient as well as the physicians. The moral and legal issues surrounding different forms of assisted death have been a topic of discussion among those in medical fields for decades. Physicians face numerous ethical concerns when confronted with patients requesting to end their life. According to a national survey of physician-assisted suicide and euthanasia in the United States, there are numerous factors that affect a physician's decision to assist a patient in ending their life, including their own religious beliefs, the region in which they practice, their specialty, and the law in their state. The physician has to decide whether to honor the patient's wishes to die based on factors or to deny them assistance in ending their life. The patient's legal right to make their own decision on the government's role in establishing regulations over these rights have been argued across the country in the U.S. since 1976. As of 2015, 5 states, Oregon, Vermont, Montana, California, and Washington, have already recognized a patient's right to make their own decisions about dying with dignity and have legalized physician-assisted suicide. In Stephen R. Latham's article, Aid in Dying in the Courts, he discussed the various court cases involving this topic and the outcomes regarding their patients' rights of ending their own lives. In Morris v. New Mexico, 2014, a judge decided that the state constitution protects a fundamental right to aid in dying. Similar cases are also being presented in New York and California, seeking the right of the patient to decide whether or not ending their life if suffering from a terminal illness. The argument is that patients are going to inevitably die from their disease, so hastening their death is not a fact suicide. Also, the patient has the right to end their own pain and suffering related to the disease in respect to the rights set forth in the state's constitution to safety and happiness. There were 2 recently extremely publicized cases in the United States that address both the ethical issues of the physician's and the patient's legal right to choose. Recently, numerous cases of physician-assisted suicide and the legal or ethical concerns surrounding it have been covered in the media. In 1997, Oregon established the Death with Dignity Act, which allowed terminally ill patients to end their lives with the assistance of physician-prescribed medications. One of these cases involved Brittany Maynard, who was diagnosed with stage 4 glioblastoma, for which there is no cure. This young woman underwent several surgeries to stop the growth of the tumor to no success. Doctors suggested radiation to shrink or stop the growth of the tumor, but after much research and discussion, she discovered that there was no cure for her cancer, and the suggested treatment would significantly impact the quality of the life she had left. In an interview with Brittany, she stated, "After months of research, my family and I reached a heartbreaking conclusion. There is no treatment that would save my life, and the recommended treatments would have destroyed the life I have left." Brittany decided to move to Oregon, where death with dignity was legal, and seek out a physician that would assist her in ending her life on her terms, free from pain and suffering. After spending time with her family and completing her bucket list, Brittany Maynard ended her life on November 1st, 2014. Another recent case was that of Terri Schiavo, which ignited significant controversy regarding euthanasia and a patient's right to decide because she did not have any advance directives or a living will established to state her wishes. Terri suffered from cardiac arrest in 1990, leaving her in a permanent vegetative state, in nursing home on life support for years. Her husband petitioned the court in 1998 to end life support and remove her feeding tube. Since Terri did not have any advance directive, her parent fought the court ruling for 7 years to have her feeding tube reinstated. Initially, the court refused to honor her parents' wishes, but her parents moved to their case to be heard by the Florida state legislature. After years of court hearings and the eventual intervention by President Bush himself, Schiavo's parents fought to allow their daughter to remain on the feeding tube. In 2005, the courts rejected the legal attempts to continue the feeding tube, and Schiavo died March 31st, 2005. These examples of dying with dignity have led to much discussion about whether physician-assisted suicide or euthanasia is legal, moral, and ethical in the United States, and under which circumstances dying with dignity is acceptable. Whether it is termed physician-assisted suicide, dying with dignity, or euthanasia, the argument is that in case of the terminal illness, the patient has the right to refuse medical treatment or request assistance in ending their own lives. These physicians have an ethical responsibility to the patient, but also a legal responsibility to follow the legislation set in place by our government. These two requirements also often affect a physician's decision to honor their patient's wishes and eliminate the pain and suffering. In the two cases presented, the patient's quality of life was being threatened. Hope for improvement was lost, and both Brittany Maynard and Terry Schiavo's husband felt that ending the lives of these women was the best solution to allow them to die with dignity. Thank you.